All right, I am Dr. Shill, and we are live today looking at medical news in the healthcare space. So, this is something new we're trying. Want to see if we can get some good information out there for you. I think we're not set to go live for a couple minutes more, um, but we're going to go ahead and go live now. There are several things that I wanted to address from a healthcare perspective today. And so, first thing I'm going to mention is it looks like both in the state of Idaho and in the state of Washington today, there are things going on with respect to Medicare and Medicaid expansion. Looks like Idaho is working in their Congress to roll back some expansions that they had done. And it looks like they're pretty split on that. So if you have an opinion about Medicaid or Medicare expansion and you live in Idaho, now would be a good time to reach out to your state representatives and share with them your opinions because the state of Idaho is moving in that direction. Second, let me pull up an email that I received today from folks for the state of Washington. State of Washington is looking at trying to shore up the Medicaid access program. Medicaid in the state of Washington is known for underpaying. And I think underpayment is an issue for Medicaid programs across the country, but specifically in Washington, it's a very, very low reimbursement. Now, I don't have the exact numbers in front of me, but to give you an idea, an office visit that might reimburse $150 commercially, with like a Blue Cross Blue Shield plan, pays less than $50 in the state of Washington. That is something that makes it hard for doctors in the state of Washington to take Medicaid. So the House bill in Washington considering trying to improve that is bill number 1392, and the Senate bill is number 5372. And if you have an interest in Medicaid access, people being able to get good Medicaid access, I would recommend you reach out to your representatives. As an example of how this plays out, healthcare providers do look, number one, whether to even take Medicaid, and then number two, how much Medicaid they take. So I had a patient who was trying to get a primary care doctor, and because they were on state Medicaid and because Medicaid reimburses so little, the next appointment to get a primary care appointment was only about a few weeks out. But as a Medicaid patient, the next appointment was 8 months out. So definitely something that is impacting people in a real way, as the Medicaid program is not reimbursing enough in the state of Washington. Let's take a spin now and look at some health news that is affecting us with respect to weight loss and medications. So I saw an interesting article this week. I don't have a strong opinion on it other than to say I'm excited that we are looking at other ways to stimulate weight loss. Now, those of you that have followed us in our weight loss clinic, you know that we really believe in making lifestyle changes that will make weight loss durable. And so one of the concerns that I have about medication in general for weight loss is that most medications for weight loss require lifelong consumption of those medications. And while there are definitely patients for whom that makes sense and for whom that is appropriate, I want to be sure that you understand that I think we have not yet reached the holy grail, if you will, of what the best treatments for obesity are. Now, in our clinic, we use OptiFast, and OptiFast is a medical grade meal replacement that people use temporarily to help get their weight down quickly. We work very hard in our clinic to help people maintain their muscle mass. Muscle mass is probably one of the most important things, one of the most important metrics that I use as a doctor to make sure that my treatments are providing not only short-term health, but long-term health. So, article in the New Atlas magazine today, actually, I think I saw this a couple days ago, so not today, starts by saying gold outperforms common weight loss drugs and leaves the muscles alone. So I thought this was really interesting. Now, for those of you who have followed medicine for many years, you may recall that gold has actually been a treatment that we've used before in rheumatologic conditions. And we've tried to treat rheumatoid arthritis with gold before. So it's not just swallowing your wedding ring, but using gold nanoparticles, it says, can offer significant targeted weight loss that focuses on fat or lipid tissue without affecting muscle structure. So to me, this is really, really interesting because we are looking at things that go after the fat and not the muscles. When you lose weight on your own, typically we see about 25% of the weight you lose will be muscle mass when you lose weight. And when you use medications to lose weight, such as the GLP-1 medications, like Ozempic, like tirzepatide, like Mounjaro, some of the manufacturers' own studies show that that weight loss can get as high as 40% muscle mass by weight. So very interesting, very important to know. Interesting that these gold nanoparticles that they're using to potentially treat weight loss are showing some anti-inflammatory properties, also improving blood glucose levels. The study is being done at Egypt's Alexandria University. And so they are working on that. And what's really interesting is that they are seeing potentially even more weight loss with gold nanoparticles than we have been seeing with the GLP-1 class of medications. Now, as a general rule, we see about 10 to 20% weight loss with GLP-1 medications. With the gold nanoparticles, it looks like they're seeing about 36% targeted fat reduction over time. Now, here's the big catch to the study, and I think it's so interesting. These kinds of studies come out, and we put them out there, and we make them available, and they kind of put down in the fine print, this was not a human study. This was in a rat study. And so, fantastic that we're seeing it. Rats is where we start a lot of our measurements and our treatments and where we see what's going on. However, be warned when you look at a study, if it's in rats, sometimes those studies are not going to translate in the same way to the human environment. So very interesting article. I am going to drop that article link here in the chat for anyone that wants to take a look at that article. Again, I think there's some problems with this, but also some very interesting things. So take a look at that. Enjoy that article if you would like. Let's take a look at some other health news here. And we're just trying to do this live, give you some live impressions. We have not taken the time to prepare this in advance, and that is entirely on purpose. Briefly, I'd like to take a minute to look at a New York Times article published about 3 days ago. And it says, physicians really are healing themselves with Ozempic. And this article goes through and is the story of a cardiologist who goes to conferences and notices that people he has been spending time with over many decades in his career have been using Ozempic and other GLP-1 medications to lose weight. And hey, isn't that great that people are changing their life, extending their life, reducing their cardiovascular risk? They are making improvements in life. And, that's really good. And at the same time, there's some questions about safety, security, all of those things. None of the GLP-1 controversies have gone away. But the point of this article is to say, when doctors use a treatment on themselves, that's a pretty good indication that it's a treatment at least worth investigating. And so definitely, if you are looking at weight loss or needing to lose weight, a GLP-1 is worth considering, worth taking a look at, because the doctors are using them. There are lots of opinions about whether GLP-1s are the right choice. But at the end of the day, I think this article makes a really good point. If doctors are using GLP-1 medications, then it should bear some weight for us to say, hey, this is probably worth our time to look at this treatment modality because there's probably something there. All right, that is the time that we have for this morning to do some live medical news review. I will plan on doing this a little bit more often. Sometimes it takes a little while to actually put up a short and edit it and publish it. So we're going to try doing some of these live videos where we just take some time, review some of the medical news that's going on, share information about recalls with you, share information about different things that are going on in the medical news. If you get a chance, drop a comment. If you watch this after the fact, let us know what medical news you'd like us to cover, and we'll take some time and we'll do it for you from time to time. Hope you have a great day. Remember, the future is bright.